The CDC says the average number of new infections in the U.S. has surged to more than 176,000 people per day. That's the highest it's been in almost a year. I want to bring in Dr. Susannah Hills. She's a pediatric airway surgeon and an assistant professor of ear, nose, and throat at Columbia University Medical Center. Thanks for joining me, Dr. Hills. So let's jump right in. What are the factors driving this current spike in cases? And then are you concerned about the numbers going even higher after these family gatherings this weekend?
Yeah, Jessi, I'm really concerned about these numbers going up. And we know that that's likely to happen because it's exactly what happened last year. Our highest case rate throughout this pandemic occurred a week after New Year's this year, which was January 8th. And so we know that these holiday gatherings, these group settings, many of them indoors, are the driving force behind spreading these infections. And that has been the case throughout the pandemic. Right now, the driving force is still these indoor gatherings, but it's also the fact that this variant, this new Omicron variant, which has clearly taken the lead in our country and is accounting for really the majority of cases right now, is extremely transmissible. It is infecting people who are vaccinated and unvaccinated. It appears that people who are having their boosters are more protected and are much less likely to get infected. The important thing to remember is that the vast majority, nearly all of the cases who are ending up really sick in the hospital are people who are unvaccinated. That includes adults and children who are unvaccinated right now. So that just tells us that we need to be pushing harder and harder to try to get every single person who's unprotected protected with the vaccine.
So what do you recommend doing if someone in your household is now sick with COVID-19, but you're not?
Yeah, that's a tough one, right? It's really hard to isolate from somebody who is in your household. I think there are a few parameters to look at. First of all, is anybody in your household particularly high risk? What is your vaccination status? What is the immune status, the age, the underlying health factors that could make someone in your household more at risk for severe infection? And if there are people in the house who are unvaccinated, if there are people in the house who have other factors that make them a high risk for severe infection, then it's incredibly important to really try to isolate the infection as much as possible in the house. That means wearing masks, hand washing, really trying to cut down on the amount of spread in the house that could affect those who are at risk. Of course, getting a vaccine and getting a booster for everybody who's eligible as soon as they're able to go out and aren't infectious and can go get the vaccine is incredibly important too. And finally, doing the testing to make sure that others in the household aren't infected, or if they are, that they're not going to school, not going to work or indoor places where they can spread the virus. And that's a really incredibly important step too. And I know getting those tests hasn't been easy, but I was very pleased to see at my local pharmacy over the weekend that they finally had shelves of at-home testing available for those who are able to buy them.
That's great to hear. And you did mention wearing masks. There's a lot of talk now about what kind of mask we need to be wearing. Many people went away from the N95 because they got their vaccines. Do people need to be going back to those N95, KN95 masks?
Yeah, the information or guidance from the CDC about exactly what masks they're going to recommend may change. But for now, they're recommending that people mask. We know that N95s, KN95s provide more protection than a cloth mask. A cloth mask provides more protection than no mask. So right now, the CDC guidance is to mask. If you're able to use an N95 or KN95, that's just more protection for you and the people around you, especially if you're at risk again, or you have somebody around you who's at risk for getting infected. Getting that N95 or KN95 is probably a good idea. But I want people to remember that this is not a message that masks don't work. Absolutely not. Cloth masks will still provide infection protection. How do we know that? We know that because all of the data we had, particularly from schools when they were in session, and those schools that did particularly well, did well last year and this fall when they were open, because kids were doing well with wearing masks. Schools where kids were not wearing masks did not do well. The masks that kids were using were not N95s or KN95s, they were cloth masks. So we know that using a cloth mask is part of that layered protection that helps keep the virus from spreading and helps keep people safe. So a cloth mask will still provide infection. Is it as good as an N95? No, but is it protection? Absolutely. And it will cut back on the droplets that are spreading to other surfaces, to people around you, especially if you're indoors or in a crowded place.
Yeah, and so we're talking about children now. You mentioned all of these cases being really largely unvaccinated people, and we're seeing the number of children hospitalized up fourfold in New York City compared to earlier this month. Is there a connection there? Are the kids getting sick because they're not vaccinated?
So clearly, we know that those who are unvaccinated, including children, are at higher risk for getting infected and for landing in the hospital. And this is what we're seeing here in New York City. There are hospitalizations are up fourfold, and that includes kids of all ages, fourfold for kids with COVID infections. And in kids who are 5 to 11, none of the hospitalizations that we've seen in New York that have been documented so far are in kids who are vaccinated. In the older pediatric population, 12 to 18, 75% of kids who are in the hospital in that age group are not fully vaccinated. So we're seeing that same pattern of vaccination impacting how sick kids are getting and which ones are ending up in the hospital. And vaccination is incredibly playing an incredibly important role in protecting children as well. Um, Again, we have to remember that we're still really behind in getting kids vaccinated. So I would just urge families, especially as we're seeing these case numbers skyrocket, to go out and get their eligible children vaccinated. Right now, in the 5 to 11 age group, only 27% of our population has one dose. Only 16% of our population in that age group is fully vaccinated. And these are the people, the children that we're seeing in our hospitals right now.
We've heard that Omicron is presenting a little bit differently in terms of symptoms. Is that the same with the kids? What are the kids suffering from in the hospital right now?
Yeah, this is what makes this virus so tricky, Jessi. It's really hard to know whether you have COVID-19, whether you have another virus that's really common in children that we're seeing in the hospital too, like influenza or RSV or all of these other respiratory infections that kids typically get. The symptoms can be very, very similar. The challenge, of course, that we know the problem with COVID-19 is that in children, this virus, if it impacts children severely, can end up causing organ failure and systemic inflammatory disease, which can be very dangerous. So this, of course, is the challenging and unsettling thing about this virus. You can't know necessarily by the symptoms what kind of virus your child might have. This is why testing is so important. So if your child has symptoms of what you think might be a cold or a virus, or you're just not sure, it's incredibly important to go get a test either through the New York City testing system, which has sites available across the city, or at your pharmacy, go get an at-home test, or at schools. Many schools across the city are having testing sites open and available as well.
And Israel is now looking into allowing a fourth shot for COVID-19 for adults 60 and older, healthcare workers, people who have weakened immune systems. They would be eligible 4 months after their third dose. Do you see the U.S. doing this too? And does the science support it?
Yeah, so we don't know yet whether the science supports this because we don't know exactly how long this first booster, this third dose, confers protection for. So it is highly likely at some point that the protection from the booster will also wane. We don't know exactly when that is. And there's some dissent even in the Ministry of Health in Israel over whether or not to make this fourth dose available broadly, whether to limit it to a small group. The reason why there's that dissent is because we just don't have the data to know for sure what the right answer is. What we do know is that getting a full vaccination series plus a booster if you're eligible is highly important in protection against this Omicron variant. But before we think about getting a fourth dose, I think having the data is incredibly important, especially when we're looking at a global picture where there are many developing countries with a vaccination rate that's under 10%, and many of the problems around that around the world focus on availability of vaccines, access. And so we have to think too about getting protection to those countries before we're giving fourth doses without data that suggests that that's necessary.
Definitely a disparity there. Dr. Susannah Hills, thank you for your time. Thanks for joining us.
You bet. Thank you.